Så hon är en registered nutritional therapist, hudterapeut, kosmetolog med mer än 30 års erfarenhet. Hon specialiserar sig på kvinnohälsa 40 plus med särskilt fokus på övergångsåldern. Hennes approach är holistisk med mix av kost, hälsa, mindset och livsstil. Förutom att inspirera kvinnor på sin egen plattform så är hon också lärare på Hudvårdshögskolan här i Stockholm. The University of West London. En stor applåd och varmt välkommen Alison Bladh!
Wow. So wonderful to be here talking to all of you fantastic people today. And I get to speak English. Yay! Now, menopause affects 100% of the population, of the world's population. 51% of the world's population are women that will go through the menopause. The other, as in the men, 49% will know somebody who is menopausal. Now, women go through 3 major hormonal events in their life. Puberty. We all talk about puberty, don't we? We all understand puberty, big hormonal shifts going on there. Then we have pregnancy, big hormonal shifts. We talk about that a lot. And then silence, the menopause. We don't talk about the menopause. And I feel it's very important that we understand this. This is a big hormonal shift in a woman's life. And as therapists, we need to understand so we can help our clients not only with their skin health, but with their overall well-being. So today, I'm going to talk about skin and well-being during menopause. Now, Katarina has given me a fantastic introduction, so I actually really don't need to say any more. She's really told you everything about what I am and what I work with. So let's get going. What are we going to be talking about today? I want to define the menopause transition. What actually happens is a lot of women that don't really understand what the menopause is. Menopause and skin health, of course, we're all very interested in that. The business value of these clients, the business value of these menopausal clients, and nutrition. Always want to talk about nutrition and lifestyle for menopausal wellness. Now, 70% of Swedish women aged between 47 and 65 have menopausal symptoms. 30% of these women say that their symptoms are severe, so they really affect their quality of life. And unfortunately, when we've gone through the menopause, if that's not enough, when we come into what we call post-menopause, we can still have these symptoms. They can go on for years. 33% of women say that they have long-term symptoms that can last for 7 years or more. And what is interesting is that women feel inadequately prepared for this event, for this transition, and they lack knowledge. They don't really understand. We don't really understand what's going on because we don't talk about it. You know, it wasn't that long ago, the 19th century, the Victorian era, that women, when they went through the menopause, were thought of as being insane. There was something called climacteric insanity. They were locked up in asylums. They used to use something called bloodletting, where they'd attach leeches to these poor women's body, and they thought that this would help to balance the bodily fluids. Luckily, we do actually understand more today, but we do need more research on women. There is a big lack of research on women. So what actually is the menopause? What is going on here? Menopause transition, that is actually what it is, because it's a transition over many, many years. And it's very individual. Every woman experiences it differently. So the menopause transition consists of perimenopause, menopause, and then post-menopause. Now, perimenopause is where things start to get a bit crazy. Hormones are all over the place. It's the time before menopause. Estrogen, progesterone, and testosterone start to go a bit crazy. Estrogen in particular can actually be quite dominant during perimenopause. And perimenopause happens on average around the age of 45. Then we have menopause. Now, menopause actually is really just one day. Because what menopause is, it's when a woman hasn't had a period for a year consecutively, she then is officially in menopause. And then all the time thereafter is what we call post-menopause, and that's the rest of a woman's life. And we're living much longer. It can be 30 plus years. During post-menopause, due to the decline and the lack of estrogen and progesterone, we are at risk of certain chronic health conditions, such as osteoporosis, cardiovascular disease, urinary tract infections, and possibly, it's a big question mark here, possibly dementia. There's research, a lot of research going on at the moment, because dementia is much more prevalent in women, and it normally happens or starts to happen as we age. Is there a connection between the lack of estrogen and cognitive health? The mad perimenopausal roller coaster. You can see it there, can't you? Things are all over the place. Estrogen, progesterone, testosterone, follicle stimulating hormone, luteinizing hormone. Things start to really get unbalanced. One thing I will say with testosterone isn't really anything to do with menopause. Testosterone gradually, as we age, declines, but it does have an effect on our well-being. And because of this mad roller coaster hormonal ride, we get the wonderful menopausal symptoms creeping in. And this is very, very individual. But I think there's a list, there's like 40, 50 different menopausal symptoms. Night sweats, hot flashes, itchy skin, irritability, mood swings, the list goes on. One thing that I want to talk about that we shouldn't forget, because it's also very important when we're working with clients, that not every woman will go through what we call a natural menopause. Many women, 1 in 100 women, will experience menopause before the age of 40. And this can be due to hysterectomy, so surgery. It can be due to medications. It can be due to anorexia, endometriosis, but it's extremely traumatic for a woman to go into menopause at a young age. There is actually something called premature ovarian insufficiency, which is a chronic condition, and this can even happen when people are in their 20s. So you can imagine how traumatic it is for a woman to go into the menopause in the 20s. We don't truly understand why this happens, but it's something that we should be aware of when we're working with clients, that not every woman will go through a natural menopause. So, onto the skin. This is what we want to talk about, don't we? What is actually happening here? So, understanding menopause and skin health. We need our hormones. And it's so important to remember that estrogen is not just a sex hormone. Estrogen is a mother hormone. It's the master of metabolic homeostasis, metabolism, and reproduction. We have estrogen receptors all over our body and progesterone. So when we have a decline in these hormones, it affects everything, including our skin. We have an abundance of estrogen and progesterone receptors in the skin. So the skin is significantly affected during menopause. So what actually happens? Why is estrogen and progesterone so important for our skin? We see aging of the skin, we see sagging of the skin. Estrogen is needed for the synthesis of collagen and elastin. The skin loses 30% of collagen in the first 5 years of menopause. We start to see pigmentation. Estrogen and progesterone are needed to regulate epidermal melanocyte homeostasis. So we see hyper and we see hypopigmentation on the skin. Perimenopausal acne is if things couldn't get bad enough, you suddenly develop acne. This predominantly, there's many factors that come into play here, but this predominantly is to do with testosterone dominance. During perimenopause, because of the hormonal fluctuations, testosterone can actually become quite dominant and trigger off acne. We get hair where we don't want it and we lose it where we do. Facial hair growth and we lose hair on the head. Again, predominantly due to testosterone dominance. Skin sensitivities. Estrogen is needed to modulate the immune system. We can suddenly find clients react to products that they never had problems with before. Suddenly skin gets very irritated and sensitive and allergic. Histamine intolerance. Now, I love talking about this because I see in my nutritional therapy practice, many of my clients suffer from histamine intolerance. And it's kind of like this vicious circle starts during menopause, predominantly in perimenopause, so the first stage, where estrogen can become dominant, can be quite high. And what happens is we need histamine. Histamine's good, but not too much of it. And when we have high estrogen levels, which we can in perimenopause, this actually stimulates the body to produce more histamine. And then, if that's not bad enough, high histamine stimulates the ovaries to produce more estrogen. So it's kind of like this vicious circle starts happening. And histamine intolerance in the skin, this is seen as rashes. allergies, breakouts. I see it in nutritional therapy as headaches, joint pains, digestive issues. It shows itself in many, many different ways. Fat redistribution. We go from a pear shape to an apple. Anybody relate to that? All of a sudden you find all this weight coming around the tummy area for no reason. And this actually affects the face because the fatty deposits on the face, we can lose them as we age. So it can cause sagging of the skin and aging of the skin. Dry skin. Now, dry skin, this is a big one, isn't it? We see this in all of our clients that they have very dry skin. Estrogen is needed to regulate sebaceous flow on the skin. Reduction in hyaluronic acid production. Decline in glycosaminoglycans, which are essential for skin hydration. Thinning of the skin. Estrogen is needed for the integrity of our circulatory system. So we see thinning of the skin. We see a lack of nutrients and oxygen being supplied to the skin. Now, interestingly, estrogen increases the activity of the hormone responsible for activating vitamin D. So again, in my nutritional therapy clinic, I see a lot of clients that are vitamin D deficient. It's more prevalent in women during the menopause transition. And then, mucous membranes. Nobody talks about our mucous membranes, do they? Mouth, nose, eyes. The big V word that nobody ever wants to say. Vagina. Vaginal dryness is very, very common in menopausal women. And it can be horrible and painful. And it's so unnecessary because all you need to do is go to your doctor because there's many fantastic products that work amazingly. But the mucous membranes are affected during menopause because of the decline in hormones. We need our hormones to keep everything nice and lubricated. Light chain sclerosis. Is there anybody here that's heard of light chain sclerosis? Hands up. Yeah, a few people. This is something that I always want to mention because it is a chronic skin condition and it's seen more predominantly in women going through the menopause transition, and it affects the genital area and it can be really, really painful and debilitating. But nobody talks about it. Nobody really understands what it is. And it's often gets misdiagnosed because it's very similar to a yeast infection. So just to recap here, common skin problems that we see in our menopausal clients: poor wound healing, aging of the skin, itchy skin, skin tag development, acne, pigmentation. The list goes on. Now, I know all you amazing, wonderful therapists out there have an array of treatments and products for these skin conditions. Hands up who can treat all these conditions. All of you. You have I know you have amazing products and treatments. So you don't need me to stand here and tell you how to treat these conditions. However, it is very interesting to talk about the value of these menopausal clients for your business. Now, you see this picture here? This was AI produced. I'm a big fan of AI. There's actually a few pictures in my presentation that are actually done via AI. So why are these women so important? Queenagers and fabsters. What wonderful names. That's what they're being called, which I love because it's positive, isn't it? Menopause tends to have this aura of negativity attached to it. Doom and gloom, the end. Queenagers and fabsters, a new beginning, hurrah! These women have spending power and influence. And large studies suggest that they feel neglected and they feel invisible. Because the majority of marketing is targeted towards the younger woman. 76% of these women do not feel represented by brands, advertising or marketing. Forbes are calling these women the new super consumers. They're the ones with the household strings. They're the ones that hold control of the money. 95% control of what they spend, what the household spends its money on. And what's so interesting for us is that they love spending money on themselves. They want to feel better. Surveys, actually very interesting, I thought was made me smile, that they time for themselves. So self-care was more important than time with their partner, a job they love, friends, or an active sex life. So time for themselves, self-care. They love spending money on themselves. Wonderful. What we can offer them with treatments and products. And they're very interested in health and wellness. Now, wellness is the word. When we look at health and beauty trends for 2024, wellness is the word. And what is wellness? It's very different, isn't it, for everybody? It's a holistic approach. It's a whole body approach. The trends for 2024 are very much focused on this group of women, on the menopausal transition, prioritising wellness. This is what the trends are saying, that it's the whole body approach. There's going to be a major focus on women's health, fantastic, and more research on women, which is great because there is such a lack of research on women. The majority of research that is done is on men. So increase the research in women aged 45 plus. Now, interestingly, I don't know if anyone's heard of this, but there is something called psychodermatology. This is a very modern way of thinking. And a lot of the time during menopause, not only does it affect you physically, it also affects you mentally. I'm perimenopausal, and I can honestly say my brain sometimes just stops working. That brain fog, the cognitive effects are huge, and also emotional well-being. So psychodermatology is really looking at how our emotions affect our skin, because they do. And they've taken it, the trends have gone even further to neurocosmetics. So looking at products that you can apply to the skin that actually will have an effect on our neurotransmitters. And the trends are saying that there's going to be an increase in the demand for products for healthy aging and longevity. Now, when we look at the menopause, when we look at women as we age, it's a bit like a jigsaw puzzle. You have to get everything in place. You can't really just do one of the things. You need to do them all to feel great, to get that wellness feeling. Good professional salon treatments, products, nutrition. We need to think about what we eat. We need to think about our lifestyle. It's kind of like, as you get older, you can't get away with what you did when you were younger. Even if you think that you're going to be able to, I can assure you it's not the case. And so nutrition, I love talking about nutrition. I could talk about nutrition for days. And as you can imagine, this is a very large subject, especially when it comes to menopause, because there are many nutritional things that you can do to feel better, to look after yourself. Now, working as a nutritional therapist, if you think how much nutritional information is out there, there's a vast amount of nutritional information on the social media, on the television, everywhere. And everybody has a different opinion, don't they? No, you should eat that, you should eat, no, you shouldn't, yes, you should. It's totally confusing. Now, as a registered nutritional therapist, everything that I say is actually evidence-based. I have studies to back up what I say. And when we look at styles of eating, the Mediterranean style diet always comes up top, always in all studies, as the best way to eat. Also helps to reduce menopausal symptoms. And what does that actually mean? What is the Mediterranean diet? It's eating whole foods, it's eating poultry, fish, seafood, vegetables, nuts and seeds, all the wonderful healthy fats like your avocados, olive oil, very little sugar, virtually no processed foods. It's a sustainable way to eat and a very healthy way to eat. When we look at key nutritional points to think about for menopause and for our clients, one key thing that we don't eat enough of as women is protein. You know, you really want to be eating protein with every meal. Well, protein, meat, poultry, fish, if you don't eat meat, soya products, nuts and seeds, beans. And then fats. I know that the era that I grew up in, fat was a swear word. Nobody ate fat. It was all high carbohydrate. But now we've understood that we do actually need fat. And fats help improve the skin. And they also help us to produce hormones. Because we need fats, but it's the sort of fat that you eat that is important. Omega-3 is very important. This comes from fatty fish, and you can also get it from algae. And then omega-7, I don't know how many of you have heard of omega-7, but omega-7 is actually going back to mucous membranes. Omega-7 is wonderful to keep our mucous membranes nice and moist and lubricated. There's something called sea buckthorn, which contains a very high percentage of omega-7, and that is very, very good for our mucous membranes. Sea buckthorn. Hydration. Do I need to even talk about water? We need water for our skin health. We need it for our digestion. But do we drink enough water daily? Phytoestrogens, plant estrogens, wonderful for menopausal women. It actually has a very similar chemical structure to estrogen, and it's been shown in studies to really help with menopausal symptoms. Things like linseeds, great form of phytoestrogens, soya products, and then the gut, our digestion. This is really affected when we have a decline in estrogen and progesterone. We need that for our gut integrity. So eating probiotics and prebiotics, this actually helps, it feeds our gut bugs, the gut microbiome. Probiotics are things like sauerkraut, kimchi, fermented vegetables that have all these wonderful bacteria in them. Prebiotics are what feeds the bacteria, so it's kind of like the food for the gut bugs. Vegetables, virtually all forms of vegetables are prebiotics. And then we have fibre. Now, nobody talks about fibre, do they? Fibre's not very sexy, is it? Fibre. Now, we need fibre, and we certainly don't eat enough fibre. We need it for many things, including elimination. And as women, we need fibre to be able to detoxify our estrogens. So if we're not eating enough fibre, what happens is your body can reabsorb all these old estrogens back into the system, which we don't want. And then ultra-processed foods. We live in a very toxic food environment. There's food everywhere. But the ultra-processed foods, the packaged foods, the foods that are high in sugar and damage fats, we really want to avoid. You know, if you can't pronounce the ingredients on something that you're about to eat, then maybe you shouldn't be eating it. There's something called sugar sag. Sounds horrible, doesn't it? Sugar sag. If that's not enough to make you stop you eating sugar, I don't know what is. Now, sugar sag is when we eat too much sugar, basically. And when we eat too much sugar, it causes a process called glycation. Now, I'm sure you're all aware of glycation. Glycation is when protein and sugar bind together in the circulation. And when this happens, it produces something called advanced glycation end products. And that's not good. We don't want them, because what they do is they break down collagen and elastin fibers in the skin. So they age the skin. If you've had a weekend where you've maybe overindulged, a bit too much wine, a bit too much chocolate, all of those things that we all do. Monday morning, you look in the mirror, what happened? Sugar sag. Lifestyle. I have to mention lifestyle because this is part of the jigsaw. You can't get overall wellness without looking at your daily habits, because that's really what mounts up. What we do daily is really our overall health. During menopause, because of so many things going on with all the hormones, we really need to take care of ourselves. So lifestyle, things like sleep can be a problem during menopause. Really looking at sleep, looking at movement. We need to move, and we need to move daily. And then stress management. You know, it seems like everybody is suffering from chronic stress, and this is so detrimental to our health. So finding ways daily to manage your stress is crucial. So, what have we actually been talking about today? Just to summarise, estrogen, progesterone and testosterone are crucial for our overall health and well-being. Menopausal women are feeling neglected and ignored. With nutrition, lifestyle, professional salon treatments and products, we can greatly assist all aspects of our health and well-being. during menopause, and for all the years thereafter. Now, I said at the beginning of my presentation, menopause affects 100% of the world's population. Now, although you will only be treating a portion of this, as in the women, you will actually be having an effect on the whole population, because by improving your client's skin and overall well-being, you will actually be making them happier. And by making them happier, you will be having an effect on the 49%, as in the men in their lives. Because who doesn't want a happier wife, mother, sister, daughter, or friend? Now, I've put together a free gift for all you wonderful people. It is an ebook, and it's a 7-day menopause reset. Sounds great, doesn't it? Energize your brain and body. So it's very, I understand we haven't got hours to spend in the kitchen. Very easy recipes, 7-day meal plan, even with a shopping list. So please feel free to scan that QR code. And I think that the QR codes are actually around where we've been drinking tea and coffee as well, if you want to do that. But thank you so much for listening to me. It's such a pleasure to be here talking to you all today. If anyone wants to learn any more about me and what I do, I'm on virtually all social media platforms. If you just look for Alison Bladh, you'll find me there. And please feel free if you have any questions. I'm here for the rest of the day and evening. So if you have any questions, please feel free to come and ask me. But thank you so much.
Thank you.
Oh, thank you.
Thank you so much, Alison. I am sure everyone found this as interesting as I did. And yes, I am in my perimenopause. So 2 quick questions. Super quick. What kind of skincare? I know it's kind of a stupid question, but do we need to think differently when we recommend skincare to women with menopausal skin symptoms? Or can we just go with a regular anti-aging thinking?
No, you can go with the regular anti-age thinking. It's moisture is key. Moisture is so important because of the effects of estrogen decline. But we don't really need to think differently. No.
Good. And the last question, it's a popular myth at the moment. Speaking of good oils, the rapeseed oil or the seed oil dilemma, on TikTok and social media, people, self-proclaimed experts, tend to say that seed oils are bad. Is that true and scientifically based?
Yeah, good question. Seed oils, when we look at fats, a lot of fats and vegetable oils and seed oils, it's the way they're produced that causes them. They're heated up to extreme temperatures, which changes the chemical composition. So when in answer to your question, it's a long answer. It depends. It depends on the seed oil you're buying. What advice I would give you when buying oils, always buy cold pressed, organic.
Yeah.
And really try to stick to good old olive oil. Again, organic, cold pressed, butter, coconut oil, all of those things. Seed oils are okay, but cold pressed, organic.
Thank you. Thank you so much, Alison. And I have a gift for you.
Oh!
I have a little gift for you. So you will have 2 goodie bags.
Oh, thank you. Thank you so much.
Thank you so much.